Hello.
Hey,
Welcome to Fire Your Doctor.
thanks. With your host, Dr. Danielle Lockwood.
And Richard Lockwood.
Hey,
We're here. We made it. It is actually the evening time. We don't typically film in the evening. That is why we look a little not like we're supposed to be here. So.
we're not supposed to be here.
So, what are we talking about today, Rich? I'll just slide that over here.
You're going to tell me. I mean, I remember from earlier, the Terrain Wellness Way.
Yes. Our medicine, it needs a reset. So this was the birth of the Terrain Way and how we do it. If you don't know, we run a medical clinic in Southwest Washington called Terrain Wellness. And that name Terrain is really about your body's landscape. And it's the idea that if the landscape is in balance, then disease cannot exist, or I should say, it doesn't like to exist in certain terrains. So we really go after how the body as a foundational level works. We call it slow medicine. It takes listening. It takes an idea that we want to redesign how the current health care system in the United States is running. I would say it's in other countries too, but we live in the United States, so we can talk about that. Especially all of those things got highlighted after the pandemic. And,
Which one?
the thing.
Is that like when there were a lot of squirrels?
What
No.
are you talking about?
What are you
Squirrels.
talking about? I don't know.
What is happening?
I don't know. I just
Okay.
the other one.
The other one.
The other one.
I think the thing that, and we've talked about it before, our response during the COVID-19 pandemic. And
Oh, that one.
yes,
That old thing.
we want to acknowledge that even with all the critique that we've given to conventional medicine, the biggest critique we have for that is how disappointed we were as to how they showed up, not even doing the thing that they were trained to do. They've got the power, they've got the resources, they've got the authority of conventional medicine, and it's still, that system still did not rise to the moment.
Well, what's funny is there were a lot of elements within conventional medicine that knew that things were wrong. And those elements were shut down, ostracized, moved off to the side, told to just get in line or get out. And unfortunately, a lot ended up getting forced out. I mean, as an example, routinely we were told, oh, well, the hospitals are getting overrun. The hospitals are getting overrun. They're sending people home. They really don't have anything unless you're so sick that you need a ventilator, etc. And so they were just sending these people home. And then you'd find, oh, well, I guess this person just kind of died in their house and nobody even knew. What's interesting is these patients were being sent home with very simple conditions that hospitals, even very low trained hospital staff, knew better than. An example would be blood oxygen saturation. So what would a good baseline for like a pulse ox reading on a patient?
Over 95%.
Okay, that'd be ideal, would be over 95. A healthy person, often you're going to read
Yes.
98 to 99%.
Yep, be as close to 100 as possible.
If you're kind of, if it's a little cold outside, your hands are a little bit chilly, maybe 93, 94, 95, kind of in that range. Rub your hands together, kind of shake it out a little bit, and you should be able to read 98, 99.
For our listeners who don't know what a pulse ox is, it's a pulse oximeter, and it's usually something that's put on one of the fingertips, like a little Pac-Man that goes over the fingertips, and it measures.
It's a small battery-powered medical device.
Mm-hmm. And it measures blood oxygen. So how much oxygen is going through your blood.
Anyway, so prior to the pandemic, even like an EMT basic, so we're talking about somebody with a few months of medical training. So it's like, I want to get into the medical field, or I want to get into be a first responder. Your first step would be like an EMTB. So a few months of training, take it at community college. And one of the things that you'd probably learn in that would be what a decent pulse ox reading would be. If you're below 90, your doctor is probably going to prescribe supplemental oxygen. And during the pandemic, we saw patients getting sent home from the hospital like, okay, nothing, we can't do anything. COVID's a killer. Go home. We can't do anything. And we would test their readings, their blood oxygen readings, and I saw patients in the 70s, not 70s age, like 70%. So
Yeah.
20 points below. And the reason that this is so concerning is that home oxygen is something that is very simple. The doctor writes a prescription. Oh, you know what, grandma, you know what? She's recovering from surgery. She needs a little bit more oxygen. Otherwise she seems okay. Oxygen's below 90. Let's go ahead and let's get her on a couple liters of oxygen. Home health is going to just drop this machine at your door. You plug it in, you put the little snake tube that goes around your nose and kind of hooks
Mm-hmm.
behind your ears, and grandma's still smoking, but we're just dealing with it. Oh, but anyway, home oxygen is pretty simple and it's well understood by conventional medicine, and yet they were told, "Oh, this is COVID. This is different. Just send them home in the 70s, send them home in the 80s." And anybody at the hospital should have known better.
It was hogwash, to say the least.
And so that's the thing, is it's just like even things that conventional medicine just were well understood. I mean, the guy mopping the floor knew that your oxygen level should have been at least above 90, ideally above 95.
Yeah. It was a travesty on multiple levels. Let's talk about the reality, though. This is what happened. They insisted that they were, quote, the science. When the world needed humility and collaboration, they doubled down on control. There was no apology. There was no accountability. There was no reflection. Ventilators were never a good idea. Masks never really stopped the spread. The vaccine never stopped transmission. Forcing people to get the shot was always a mistake. Closing grade schools for a year or more did irreparable harm to our children. The virus was man-made in a lab. Many people who took the jab now have long COVID. Tell me, at what point are we going to have some reckoning around this?
Yeah, and I mean, it just seems like the world has kind of moved on and everybody's like, okay, well, back to normal. And it's like, well, wait a minute. If you can just be your entire healthcare system just kind of activated into kind of an autocratic control, that's who even are these people and who's really in charge? It's not the doctor at your bedside.
Yeah. It's really sad.
And they're just following orders.
They're just following orders. They're just taking it's
what
really top-down medicine at this point.
Yeah.
It comes from the bureaucrats at the top and the CEOs who are beholden to the shareholders and influenced by the insurance payouts.
Well, and also a lot of this stuff is written by policymakers, politicians, etc., that either have zero medical background, zero medical training at all, or are basically, I mean, when was the last time our boy, Mr. Fauci, when was the last time he ever saw a patient?
I know.
Like he didn't. And that would be,
I don't even think he was actually ever in medical practice.
But that's what I mean.
I think he's been a lifelong bureaucrat.
Right.
Vying for grant money. Like that is what he's been doing.
Well, yeah.
And
at least he had some medical training, but a lot of these, it was like the mayor or a governor or this or that, or just some kind of like a business person or somebody that's like thinking about, well, the political optics of this will look this way.
And then well-trained doctors with 20, 30, 40 years plus experience.
Department head cardiologist.
You know who you are. Dr. McCullough. It's like, what? You're not going to listen to them. You're not even going to take a second glance. It's like they were silenced, outcasted. And McCullough's been very open. The only reason he was able to do that is because he was near retirement. You know, a lot of these doctors were like, well, we knew what we needed to do, but I don't know. We were just following orders.
Yeah.
I'm just not okay with that.
It made it easier for him to do what he did. But there was what was the guy in New York? I forget his name. He was like an anesthesiologist or something in New York.
I don't remember, but he got fired for telling people the ventilators weren't working.
Yeah.
We were watching it live and trying to find out as much information.
His arguments were rock solid. And he was like, well, here's what I'm seeing in clinic. So let's break this down. We started to see this about 20 to 25 years ago. It was actually the PBS show Nova, and they were actually talking about how this new kind of standardized medicine, how they were going to basically take the idea of standard of care and move it out institutionally. And that one of the big problems they were having in medicine is that you had all these kind of independent doctors just kind of treating patients and they didn't have really standardized protocols, and that this was a bad thing, and that over the coming years they were going to get all these kind of rogue doctors in line, and that this was going to improve patient outcomes. And yeah, I saw this in my early 20s, and it was this thing, and it was like, hey, this is going to be the future. And unfortunately, we're here. And now we have this very autocratic, top down, centralized control, more of a dictatorship model or a kind of a communist model of healthcare, where decisions are made in closed doors by people that are more important than you, and we're just told what to do. And the outcome of that was not this better patient outcome. It was more just centralized control.
Mm-hmm.
So the benefit to having a lot of rogue doctors is you would get kind of outliers that honestly made mistakes, and that's regrettable. But the other thing is you would get real-time data from the field. You would get 100 doctors, 1,000 doctors, maybe even a couple thousand, 5,000, whatever, doctors treating similar types of diseases and injuries and conditions. And they would start kind of basically creating emergent solutions. Like a doctor over here was like, well, hey, we tried this one treatment and I got these benefits, but I got these side effects. And somebody else is like, well, hey, we were seeing a similar case in Texas, and what we did was this. And then out of this kind of fusion of ideas, all of a sudden we have 1,000 different ideas being test bedded across the country. And now we can distill, in even as short as a few months in an emergency, we can distill the best ideas from the entire world's doctors, because these doctors are free to discuss what didn't work, what did we do wrong, what did we do right, what do we need, what are our treatment goals. And this basically kind of gives you, it's almost like a super intelligence. Doctors are hopefully smart.
Well, you forget that we have a medical practice.
Yeah.
Medicine is an art, and they're trying to take the art out of the medicine and really allow us to treat the patient that's in front of us, not
Right.
the best drug that will fit the patient that might work from this cohort study. We should use the studies as a guidepost, not as the final law.
Right. Right. The point is, though, is that having a diffuse authority structure allows for novel approaches to be developed.
I love this quote from the book. The guardrails of the rigid system became railroad tracks with a one-way
Yes.
ticket to a crash.
Yes. And so the other side of that, people would argue that you do need some kind of what they would call a standard of care in medicine. And that makes a point. Just like, oh, give me a good example of something that you just don't do that would have been common practice 50 years ago, but now falls outside the standard of care, and for good reason.
Bloodletting.
Yeah. I mean, don't you still see it a little bit for...
You do, for hemochromatosis.
Yeah.
But it's like therapeutic. They call it therapeutic phlebotomy, right?
There you go.
Basically just draw the blood. Okay, without the leeches.
The age of here and there, there's slight uses
probably
for
some uses
leeches.
for leeches,
I
too.
think sometimes they were using them in...
amputees.
Yeah, amputees, or in basically like reattaching limbs and things like that.
I'm sure there's uses, but not to the level that we would need to.
Well, yeah. So the example would be things like
mercury.
Heroic medicine, using mercury, unless you're that one thing that YouTube doesn't like us talking about.
Exactly.
That's
it's
totally
okay to use it there on
it's
babies.
Safe and, that's
only
safe
on babies.
No, but it's safe and effective.
And 2-year-olds.
It's safe and effective.
Yeah,
it's safe
exactly.
Absolutely.
Okay, systems that refuse to admit error cannot grow. That's true. They become dinosaurs. This is this is what's happening right now, is that medicine is very stale on some levels. Of course, there's innovation. I think there's a lot of surgical innovation that I think is fantastic, right? That their procedures are quicker, and the use of robotics within surgery rooms is creating better outcomes and checklists, and all of that still stands, I think.
That's because surgery has God's critique.
Okay.
And I just came up with that phrasing, but the reason that I mean like surgery has God's critique is it's like if you were grading somebody on, say, like how well they got down Whitewater Rapids, the first thing that you would look at is who made it. And so surgery is going to naturally have a filter of, did this surgeon's plan and kind of like actualization of that plan work in real life. Well, I've got this brilliant plan and I'm the smartest doctor and you should have me do this surgery. Well, sir, the patient died. Well, that's inconvenient. Like, do you know what I mean? And so I would say surgery is probably less influenced or less negatively affected by kind of wokeness and medicine because there's real tangible outcomes
Yeah, another level of excellence that you need.
of that plan work in real life. Well, I've got this brilliant plan and I'm the smartest doctor and you should have me do this surgery. Well, sir, the patient died. Well, that's inconvenient. Like, do you know what I mean? And so I would say surgery is probably less influenced or less negatively affected by kind of wokeness and medicine because there's real tangible outcomes.
Yeah, another level of excellence that you need. Okay. So
Surgery,
surgery,
there's
yes.
real
Excellence in
tangible
surgery.
feedback that is uncontroversial. Either the surgery was successful or it was a failure. And so it's getting real outcomes. Whereas now we're kind of just getting this nebulous cop out of chronic illness, autoimmune, things like that, that are, we would argue, negative outcomes happening from medicine that's being practiced, but they are not as linear in their effects as, say, like a surgery. I went in for this heart surgery and I died, right?
Yes.
Whereas the doctor put me on this antibiotic, helped for a while, 5 years later, and what's happening to me, Danny?
Systems that refuse to admit error cannot grow. Medicine must choose repent or repeat.
I like that.
Repent or repeat. You have to make a choice. Do you want to repent for what you've done? There was no apology. There was no admitting that we did things wrong. There was nothing. It was literally brush it under the rug, move it along.
As far as like COVID
or just anything. This didn't work. We're seeing kids being harmed by this particular drug. It's delaying how quickly it's pulled off the market, even though everybody knows it's not good. We know the system's not working, yet we just all, I don't know, there's just this deep denial. And this happened to me
we never had a public. It's not like Fauci never got up and said, listen, we were deeply wrong about ventilators. Ventilators, as it turns out, did not improve COVID outcomes. We have stopped using ventilators, and now we are using this new protocol because it will save lives and save taxpayer money. Like there was never ever any come to Jesus. It was like all of a sudden CNN was like, we need more ventilators. We need more ventilators. We need 100,000 ventilators in the next month or people are going to die. And then all of a sudden, everyone stopped talking about ventilators. And it was just, what's a ventilator?
And there was just hallways and hallways full of warehouses of unused ventilators that cost hundreds of thousands of dollars.
Yeah.
The entire thing was an absolute sham. And the only argument we got from America's doctor was trust the science. Just trust the science.
That's something that
I'm like, what science are you looking at? This has absolutely nothing to do. I was reading somewhere between 12 and 18 studies a week to sift through the data to figure out what we were going to do. He wasn't looking at the same science I was. He really wasn't.
Different science.
The money science.
Yeah.
It was so corrupt.
Well, the interesting thing is the phrase, and that we go into this in the book, but the phrase trust the science is actually like, there's your clue. It is patently false on its face. The entire, number one, science is not
settled.
Well, yeah, that was another one. Science is settled. Science is not somehow this incantation or like invocation that it's like, oh, we have said it. The oracle, the science oracle has said it, and now it's just decided. Science is a process, and it's actually a process of trying to eliminate biases. It's trying to ask questions, ask them again, test, test, test. So the idea of trusting science is actually antithetical to the scientific method.
100%. And I was like, what is he actually talking about? Has he taken a basic fourth grade science class where you test your hypothesis?
Oh, but he was pretty good at social engineering.
It was a mess. So here's a couple things to think about. Medical progress dies where egos rule.
There's actually a thing in astrophysics and just kind of physics in general and chemistry where they say physics progresses one funeral at a time. And Like string theory, we're coming for you.
Mm.
No, but that's a sidebar. But what it means is that it's human nature to get invested in your theories. And so, for better or worse, you would see a physicist and he's like, "Well, I'm the tenured professor at Harvard and I'm this and I'm that and I'm a department head." And it's like, "Oh, so you got your entire career riding on your ideas."
Mhm.
And you want to get your place in the history books and you want to
Mhm.
keep your funding and your prestige and your invites to all the kind of insider meetings. And so the idea that physics or science and medicine, I mean, there's a lot of truth to it's going to advance one funeral at a time.
True innovation requires humility and curiosity.
Yeah. Well, that's the interesting thing about humility is that we humans, this is one of the most profound things ever. Humans are not our ideas. And so sometimes I'm a thinker, and so I'll get like really just enamored, like
No.
in love with an idea. And sometimes the idea just doesn't work. And then that idea has to die, and it's kind of sad. But the nice thing is like when you let your idea die, then you don't have to die.
Yeah, because you are not your idea.
That's what
You
I
are also
mean.
not your feelings.
Well, yeah, and that's kind of a way of like repenting. It's just like, man, I really thought that was going to be the solution. I thought this was where we were needed to go. I tried it and I tried it and I tried it, and it's just not it.
Yeah.
And so that's a even just like letting go of an idea that didn't work is a form of repentance. What's that? Science advances through questions, not censorship. Yeah, I mean,
Mm. Yeah.
yeah, fundamentally
Yeah, we shouldn't be censored. We should be able to have open discord between people.
discourse.
Discourse, not, well, we are having open discord
Right now we're having
r-
discourse.
right now. We should have open discourse between
Yeah,
doctors, like you were saying. If we had more independent clinics and doctors running their own show and not subjected to the bureaucracy that is the hospital system,
yeah,
then we would have more innovation. That's just what happens. It's like
yeah.
the free market is a good idea. It creates innovation, entrepreneurship, independent wealth.
But also just rapid advancement.
Mm-hmm.
So when we talk about this, like one of the most fascinating things about the internet that actually the big they doesn't like is that it's almost it goes from the internet goes from chaos to order. And so it's emergent, meaning ideas are emergent. And so there's this way that 10,000 people on an internet chat or an internet forum can solve problems that would just be humanly impossible. And yet here we are. And so what censorship is trying to doing is put its thumb on that scale where, I mean, pretty much like COVID would have been solved in about 10 times less time.
Yep. It would have been solved within the first 3 months, I think.
Oh, yeah.
Yeah. Patient outcomes, not politics,
Yeah.
should drive decisions. We can't have politics in medicine. Like, it has to be removed. And that's really easier said than done because of course there's Medicare and there's public funding for healthcare and all of those types of things, but at minimum for the research institutions, we should have unbiased research. We do not have unbiased research.
So let's get back on track. Let's get to the terrain wellness way. I'm going
Mhm.
to put you on the spot. Danny and she invites me to all these, tells me to go to all these like bougie weddings and stuff from her like fancy friends. So we're at this bougie wedding and she's explaining all this like natural medicine stuff and we're at this table and everybody's all like dressed nice. And one of the guys, and he'd had a couple drinks, but he was like, "You know what? Like natural health and like this all just sounds really good and I hear what you're saying and the kind of critique of the hospital system." And this was even before COVID. "I hear what you're saying." And then all of a sudden, they're just you go to natural health and all of a sudden they're talking about the god of Saturn and all this other just kind of weird stuff. And it's just, I just ain't into that. And what I think actually gets into, I mean, it was kind of a joke, kind of tongue in cheek, but there is some truth to it in that sometimes alternative health can get so alternative that there is no standard of care. And I know it was said kind of tongue in cheek, but you can bring in some kind of like new age type practices and those types of things into medicine. And you're just like, I don't even really know what this is. And so one of the things that when we were developing the standard of care for terrain wellness is one of the ideas was like, how do we out Western medicine Western medicine,
Mm-hmm.
meaning like there are some things that are really good, like lab testing, things like that. And so tell us about the lab testing protocol that you developed. We're
We are
not
going to
there. Are
talk
we not
about
there?
that in a little bit.
Oh, come on. We got
I
to get to, I'm
thank
trying to
you.
get to the good part.
I thank
I
you
didn't
for
read my
that. We're
notes.
actually going to talk about that in the next episode, which is entire titled Labs, Lenses, and Listening. Aren't you so excited? Because
We've
I feel like
developed.
this is a very,
Yeah, yeah.
yes,
The point is that
we had to develop a protocol that created a system of order and in a illnesses disorder, right? So people are coming in, they've got 55 different symptoms, they're not feeling well. What they really need from you is a calm, orderly way to evaluate that's pretty standardized to evaluate where they are and where they can go. And so we had to start there. We talk about the difference between slow medicine. Wait, hold on. I put this on a bumper sticker for you. Hospitals are necessary. Emergency medicine is heroic, but chronic illnesses cannot be managed by emergency room thinking.
that's fine. Heroic could reference like heroic medicine, which would be prior to modern medicine. So that'd be getting back into your like bloodletting and like stuff like that.
I think they were talking more like heroes and, if you have a car crash, you're going to want to go to the hospital,
Sure.
that type of thing. If you get hit by a bus, like probably going to want to go to the emergency room on that one.
Yeah, I mean that's fair. That's fair.
Yes. But there's slow medicine and then there's fast medicine. Let's introduce you to a core philosophy. Fast medicine is treat the symptoms. Slow medicine is understand the systems. Fast medicine is protocol first. Slow medicine is person first. Fast medicine is you're fine. Slow medicine is let's investigate. Fast medicine is insurance rules. Slow medicine is physiology rules. Fast medicine is rush to medicate and slow medicine is repair the terrain first.
Yeah.
So I think what you're saying is we want to respect the conventional medicine as a base recipe, which we talk about in the book, but you customize the ingredients for the human being that's in front of you.
Yeah, sure. I mean, I guess it's just like that it's kind of like in the battle between chaos and order. So the guardrails of of care can become train tracks, right?
Mm-hmm.
Whereas so rigid that literally patients are dying because it's not in the protocol. And then it also kind of begs the question of like, well, what's a doctor even doing? Why have this person that's trained and taken like a decade of their life to train so hard just to get like a WebMD level protocol that any kind of technician with like 6 months of training could follow?
That's a great question, Richard Lockwood. And if you're a doctor or nurse practitioner listening to this episode, please contact us because we'd love to tell you the new way to do it.
Yeah, anyway, so like, and you need a standard of care. Like, you need basically like a checklist and things like that. I would say the standard of care is more important the more time is a factor. Meaning you're going to have to use like heuristics, as in if this is occurring, then that means that this is the most likely cause, and then you'd have to go through that in kind of an Occam's razor kind of fashion, and because you don't really have time. But in a lot of cases in chronic illnesses, you got nothing but time because it's just like, well, this has been around for 10 years.
Yeah, I will say that to people. But they're like, it's been 3 months, doc. How come I'm not completely better? It's like, how long have you been sick for? 15 years? I
Yeah.
think maybe you could give me a year.
Going back to labs, though, I know, but going back to labs are actually one way to really measure progress for patients. And so, one of the things that we will have with patients is that the process of recovery is so natural that sometimes patients start to take it for granted. Like, we've had patients like, well, I don't know, guys. I don't know if this is really working. I don't know if this is really working. It's like, what are you doing this weekend? Well, you know what? I started dating again. I met somebody, cleaning out the garage, going to do this, going to do that. I don't know, getting ready to run like a marathon or just like all this different type of stuff. And it's just like, I mean, you do realize that you were a grown human being taking naps because you were exhausted throughout the day when you started treatment. And now it's like you're dating, physically active lifestyle, making plans for the future. It's just like, I would say that we've done a little bit.
Just a little bit. Yeah, you have to. I take a very thorough case history.
Yeah.
My nurse takes a history, then I take a history, and we write down every detail and we organize it because that becomes the evidence for them. It's like, so you had daily migraines and now you're walking in here with no migraines. And I asked you, how are your headaches? And you said, fine, but you don't feel good yet. So, yes, as soon as people start feeling better, they do not remember how bad they felt because they feel less bad, basically.
Yeah.
So that's the problem with slow medicine is it takes a couple weeks to start to notice the effect when you use natural remedies, but we're actually treating the reason why it's dysfunctional in the first place.
Being unwell is something that most patients just forget about.
It's like, do you want me to address your symptoms or do you want to actually have this thing go away?
I mean, maybe just address the symptoms. I know that's not what you're looking
So we do run labs, but we use labs, as I say, right here. We use labs as a map, not a verdict. So it's not the end result. We also want to know the experience because sometimes it takes 3, 4 months, 6 months to really see it in a lab.
for.
And
Well,
that's what's so hard is because you have to rely on these other physical exams that we do in the office. So we do a very thorough physical exam. Often I will talk to people, they'll say, yeah, I went to see this specialist at Mayo Clinic and this and that. And I said, oh, did they listen to your heart? No. Did they listen to your lungs? No. Did they touch you at all? Nope. Like we've lost the art as physicians of a great physical exam. And so that's very, we don't smirk,
no,
but I think it's important to note that you can get a lot of information by doing proper exams on people.
that's true.
Yeah. And then, of course, we do use advanced imaging when needed. We're looking for functional markers. We do muscle testing, which we've talked about in a previous episode, but we're going to have an entire episode on muscle testing. Trauma and nervous system, we've talked about that in other episodes as well. Nutrient and mitochondrial status, hormone and immune dynamics, and also patient intuition and lived experience, hearing the patient's history, knowing you, I would say, you live with you every day. I don't live with you. So you need to let me know what you're like every day and take responsibility for that. And Rich's phrase I wrote here was out primary caring primary care. You say that too.
Yeah.
You'll say out Western medicine, Western medicine.
Yeah, and part of that was when we developed the lab protocol, we came up with a system where we would compare, number one, we would run a lot more tests than would be on, say, a standard panel or a standard hormone panel.
Proper diagnostics is
And
important.
so better diagnostics. So sometimes it's like, well, you're not really going to see this thyroid problem show up in TSH. You might even see an imbalance, and this is more like your specialty, but you might see it in the relationship between progesterone and estrogen or something, and you're just like, oh no, this here, that, and the cortisol, and then downstream from that, we're going to solve this thyroid problem, as we've discussed in detail in other episodes. But the point is that we are doing a better job at running labs, at interpreting these labs than a standard kind of primary care physician.
I think one thing I want to say is that I'm very good at recognizing patterns. And I think that's a skill that needs to be developed by most physicians is just a pattern recognition. When I see this pattern of blood tests, it tells me these things. I might want to look here, here, and here. I also teach patients that pattern. So I'll say, okay, if I see high this and low this, that pattern could indicate this, this, or this. I know it can't be this because of this. I know it has to be this because this can't exist, right? And I'm teaching them that step by step because truly doctors should be teachers. They should be teaching you about your body.
I also like your way of combining multiple modalities of lab testing. For example, some of the urine tests, we're actually looking for byproducts. So if we measured a nutrient level on a blood panel, I could be like, well, hey, there's plenty of this nutrient in your blood. And then what you could do is you would go a step deeper and you would actually compare, well, hey, we've got plenty of this active kind of bioavailable nutrient in your blood. When I look at your urine test, it's not actually getting used inside the cells. And so that
Yes.
would just be kind of an example. A lot of times it's easy to throw around kind of terms like root cause and things like that. And I know we don't really like to do that, but I'm just giving people some easy examples of ways that we would out Western medicine.
When I go down this kind of hierarchy of the way that things have to heal, so things in the body usually heal in an order. There's a safety and nervous system balance that has to happen, something called drainage and detox. That's where we give support methylation pathways, as we talked about in the last episode, basic nutrients. We want to see if the gut wall is intact so that it's absorbing what we need to give it, or we can bypass it by giving them IVs to do it. Support the mitochondria to bring back the energy to the cells, balance the immune system, regulate and balance the hormones, deal with the trauma that's in the body, and then strengthen the terrain. So we want to, again, go through this process where we're healing and getting less and less chaotic and more in this wonderful order, this divine order that really is the
I would
human
say that,
body.
like we were talking about divine order, there's a way that, so spontaneity, people think that being spontaneous is generally viewed as a good thing, but chaos is a bad thing, right? And so I was reading some of your notes and you're talking about like order and chaos. So let's think about that in healthcare. And I'm just going to throw this out there. Maybe you don't like it. Speaking of ideas that are beautiful but might get shot down. No, but autoimmune is a death by excessive stifling order. Cancer would be death by chaos, meaning like it's emergent, it's creative, it's like we are replicating, we are growing. I don't care what we're growing, we're just growing. Right. Whereas autoimmune is so much just stifling order that it's like, who needs melanocytes? Me.
Yeah.
But like, does that make sense? That it's like such order that it's actually stifling the body's creative processes.
I'm going to have to think
I
about
don't know.
that
It's just kind of
because
a fun
when I
idea.
think about autoimmune, I do think about something going off the rails and there's a failure of a checks and balance
Well,
system
yeah.
going on in the
I mean,
body.
excessive order would be that. It's like we are having so much order that the police are arresting the good guys too.
Okay.
That's what I mean. Like order so much that it's almost like a totalitarianism order.
Like a communism.
Yeah.
Yeah.
Yeah, weird.
Like
Kind of like a 1984 type where it's like it's where the immune system is exerting so much control that it's like killing off perfectly healthy cells.
an innovation
And it's, well,
and free
yes,
thought.
free thought, innovation. And like that innovation is also things like healing
Mm-hmm.
and things like that. Whereas, say, cancer is just like basically a bad idea is just kind of allowed to just kind of propagate everywhere throughout the body. And nothing is ever just like, no, no, you got to stop this. This is going to kill you. This is a bad idea. Stop it now. And so cancer would be chaos, autoimmune would be order.
Okay. I'm gonna contemplate
I don't
that
know. I'm just
deeply.
getting philosophical here on it.
Philosophical. We have a system. It failed because it worshipped certainty instead of truth.
So that would be order.
It's interesting because you need the order. You
Yes.
need an order and your body
Yes.
needs to come back
So
into
we need a
order.
standard of care.
We need a standard of care. We also need room for the art.
There is a level of perfection that becomes death.
True statement. We actually ran into this when you first ran the office. The first 6 months that we had our own office space, Rich was the front desk personnel. He was running everything, actually. Thank you.
I was also programming an app, like in between patients and doing a bunch of other stuff too.
Yes. And he was like, you have to be on time. You have to learn how to be on time because you get in there with the patients and you're just in your art. You're like the all over the place artist. And I was like, it's my art. Don't trample on my art. I need free flowing. I need to think of things. I need to contemplate.
Well, and also you'd be 45 or 50 minutes into a session with a patient and it's like, well, you got to go. And then you're just like, well, I'm finally getting to the good part. And then next thing you know, you're 15 minutes late.
Yeah.
Yeah. That would be a good example of that.
Yeah.
That'd be a good example.
And because I've created good systems and good standards, for the most part, I'm on time.
Yeah.
As long as my nurse is there, I'm actually do a lot better.
And we've also built in every 2 or 3 patients, there's a 15-minute break. There's
Yep.
a chance to reset. There's a chance to do these things. I think that also like this was part of your process of like finding your voice
Mhm.
as well. And just like, okay, I know how this story ends. We know you're angry at your husband. He is the worst human being on earth. And like, yep, he sucks. Let's use the rest of our session to like make progress and figure out how you can clean kind of your proverbial side of the street up.
Mhm.
Whereas before, I feel like you would get kind of sucked into those kind of failure stories or unforgiveness stories or things like that and just spend an hour or 2 hours Whereas now it's just like, okay, hey, where in your body does it hurt when you feel angry at your husband?
I've also just gotten better at my job.
But that's what I mean.
I've just done it so many times that the instinct is there and I can respond much quicker. I know what I'm going to do. I would say, as you know, I got the Holy Spirit on my side too. So he just helps me so much.
That really, it's a lot easier to have the Holy Spirit on your side when you're doing things that align with God's will.
I wish I would have figured that out a lot sooner. Let me tell you, I could have saved myself a lot of heartache.
Same.
So God heals in order, in wisdom, in humility, and light. Plans fail for lack of counsel.
I would like modify this.
What do you want to
God
modify?
heals in balance.
Okay.
So we get some patients that are so overly rigid that they just need to let go a little bit. We get other patients that are in that kind of chaos state where it's like, well, I'm just free flowing and I just want my freedom and I just got this. And it's just like, oh, no, 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 no. You need to get some order in this. And so I think that the beauty of creation
Integration.
is in that integration or in that balance between chaos and order, and that's where it's truly elegant, where the body is free to be creative, it's free to heal, it's free to grow, and there's creativity, etc. But that creativity has enough of a boundary that it's not just becoming it has enough boundaries that a bad idea or a bad decision doesn't just ruin your entire life.
And I would say that's how we've really tried to set up our practice too, is we have measurable goals and we have order and we have systems and we need to be on time and we need to answer phone calls and we need to pay the bills and we need to do all of those things. And we also make space for the art and for the flow of what is moving
Yeah,
and what needs to happen. Why don't you
I
read
like
this
that.
quote for me?
Plans fail for lack of counsel, but with many advisors they succeed. That's Proverbs 15:22.
You've been a good advisor to me. Medicine without humility becomes religion. Healing without God becomes mechanic. Terrain honors design and the designer.
I like that.
Me too. Okay. Well, episode 25, quarter,
Quarter.
a quarter, five. Anyway, thank you so
That
much.
didn't make sense to me.
That's because it's past 9 o'clock right now.
It's
Oh, that.
like
Oh my gosh, I
pennies,
totally just
cents.
got it. Spooky. All right.
No.
They're
Oh
that good.
no.
Well, thank you for joining us. We will see you on the next episode of Fire Your Doctor.
All right.